Hello everyone, welcome to sqadia.com and let's start our lecture, Benign Lesions of the Uterus. In this section, we will talk about the fibroids and we will talk about what's the incidence rate of the fibroid, what are the different types of fibroid, histology of the fibroids, and what are the secondary changes of the fibroids. Fibroids are the commonest benign tumors of the uterus, and these are the commonest benign solid tumor in the female. So fibroids are very common benign tumors of the female reproductive system. Fibroids are the growth of smooth muscle cell or fibrous connective tissue cells, and when they are present or when they are grown in excessive amount, they form a solid mass known as the fibroids. Fibroids are very common even during the pregnancy. Sometimes patients develop fibroids, and depending on the location of the fibroid or whether if they are allowing the growth of the baby properly or not, they can be managed during the pregnancy. But without the pregnancy, usually the fibroids are removed surgically, and removal of the fibroids is usually performed because they can cause bleeding problems, or they can cause sometimes infertility or different gynecological problems. Pelvic lower abdominal pains are also very common with fibroids. So it's important to treat fibroids, and sometimes the growth of the tissue is so extensive that it can cause huge fibromas, and even which can be palpated easily on the abdominal examination with no problem. So fibroids are very in size, from small to very huge fibroid growths. So it's the growth of the smooth muscle cell or fibrous connective tissue, and this is the histological picture how the fibroids look like. These are all the cells, overgrown or proliferative cells. The incidence of fibroids, or how common it is, this is depending on the different countries in which what's the ratio of the presence of fibroid here, and what's the incidence in percentage. So in UK here 4.5%, then in France is 4.8%, Canada 5.5%, USA 6.9%, and it keeps on increasing, and its incidence is highest in Italy. Italy is about 9.5%, 9.8% of the cases of fibroids are present. So here very the highest incident is in the Italy, and UK is 4.5%, it's on the lower side. This is the presence of fibroids in the different portions, and these fibroids are named accordingly in the areas they are present, or where this is the submucous type of the fibroid. Submucous. Subserous. This is the subserous. Interstitial or intramural. These are present inside the hair wall, intramural, below the mucus, below the serous layer, subserous. Intraligamentary, this is inside the ligament, intraligamentary. And this is the subserous pedunculated. Pedunculated are attached with the pedicle. Here a stalk is present, and they are hanging with the help of a stalk. That's pedunculated. So these are all different types of fibroids present in different. So it again submucous, pedunculated. So it can be depending on if it has a stalk or not attached to the fibroid. It's sessile, is no stalk. or pedunculated is attached with the stalk. Here if you see, it's a big stalk or attached with the fibroid. So this is pedunculated, submucous, subserous. Submucous. Inner side is mostly mucosal. It's on the inside. Outside. Interstitial is in the lumen. Intraligamentary in the ligament. So fibroids are very, very common benign solid tumors in the females. Different types of fibroids we have, and depending on where they are present. Body of the uterus known as the corporeal fibroids. From the corporeal fibroid, interstitial or intramural are commonest, 75%. Serous are 15%. Serous is subserous, which again broad ligament, which are known as pseudo or false. They can be wandering or parasitic. So commonest in the body are interstitial fibroids, which are 75%. Serous are 15%, and they can be subserous, below the serous. They can be in the broad ligament, which are also known as pseudofibroids, or they can be wandering, which are known as parasitic fibroids. Next is submucous fibroids are 5%. Corporal or body are the most common type of uterine fibroids. Submucous is 5%, which can be sessile, means no stalk or no peduncle. It's not pedunculated, no stalk. Or it can be pedunculated, which might be a polyp. They can be in the cervical region. In the cervix, they can be lateral, they can be central, or they can be posterior or anterior. Lateral is away from the side, lateral side, away from the midline. Lateral. Central is just in the center or in the midline. Posterior is on the back, anterior is in the front. So now uterine fibroids are broadly divided depending on their location. If they are in the body or corporeal, which are the commonest, then if they might be submucous, which is 5%, or if they are in the cervix. In the body, again, they are of two types. Interstitial is 75%, serous is 15%. Serous is further divided in subserous or broad ligament, which is pseudo, or wandering, which are parasitic. Submucous is 5%, which are sessile or no stalk, or pedunculated, which are stalked. Cervical can be lateral, central, anterior, or posterior. So all these are depending on their location and body part in which they are present. Now, body or corporeal fibroids, they can be, these are the cut sections of different body fibroids. This is the uterus showing submucous. Submucous fibroids are on the inner side. Subserous is on the outer side. So here, submucous fibroid, it's a big fibroid. You can see huge fibroid. Again, this is the uterus, and this is the very big fibroid here. Fibroid uterus. This is multiple fibroid uterus, not just one fibroid. Fibroid here. So this is the multiple fibroid uterus, and hysterectomy and bilateral salpingo-oophorectomy had been done. So you have uterus, fallopian tubes, ovaries, and multiple fibroids are present in this picture. Again, you can see There is submucous fibroid here, fibroid uterus, subserous, interstitial, submucous variety. All different fibroids are present. So here, all these are the pictures showing you the fibroids of the uterus. That's how the fibroid looks like in the after they are removed. And this is the microscopic appearance of the fibroid, showing the overgrowth of the smooth muscle cells and the fibrous connective tissue cells. Now, the secondary changes which can take place in the fibroids. Here in this picture, you can see the fibroids. These are the fibroids of the uterus. All these are the fibroids. This is the uterine artery. So the changes that can take place in the fibroids, it can degenerations, fibroids get degenerated. There is atrophy of the fibroids, or there is shrinking of the fibroid. Degeneration is due to the lack of blood supply. It gets degenerated, and there is atrophy. Necrosis. Necrosis is the death of the cells of the fibroid. Necrosis is the death. It might get infected. There are vascular changes in the fibroids or sarcomatous changes in the fibroid, which is the presence of the malignancy cells of embryonic period. So these are all the different changes that can take place in the fibroid, or these are the complications of the fibroids. It can get degenerated, atrophy or shrinking, necrosis or death. It might get infected. There are vascular changes of the fibroid, and there can be sarcomatous changes of the fibroid. Degeneration of the fibroids can be hyaline degeneration. There might be cystic degeneration, fatty degeneration, or red degeneration. These are the different types of degeneration that can take place. Is hyaline, this tissue is replaced by hyaline, fibroid is replaced by the hyaline type of tissue, or there are cyst forms in the fibroid, or there is fatty deposits in the usually in the fibroid, or red degeneration. Red type degeneration is very common in fibroids that occur in the pregnancy. So these are all different types of degenerations. Then calcific degeneration. Calcification of fibroid also occur. Calcification. Now, associated changes in the pelvic organ. Changes in the uterus with the fibroid, it can be distorted, it can be asymmetrical, it can be uniform, or there might be myohyperplasia. Myo is muscle. Hyperplasia is excessive growth, hyperplasia of the cells, or excessive multiplication of the cells. So uterus might become distorted, or the shape is changed because of big fibroid. It's all distorted and has to be removed. Sometimes with the fibroids, hysterectomy or bilateral salpingophorectomy is required. It can be asymmetrical, means one side big, one regular, one irregular, depending on where the fibroid is present. Or it can be uniform or hyperplasia. There can be dilation and congestion of endometrial and venous plexus also in the uterus. Then the changes which can take place in fallopian tube or uterine tube is infection, occur in the fallopian tubes. In the ovaries, they become enlarged, they become congested, there might be multiple cysts present. In the ureter, we have displacement of anatomy. There might be hydroureter. Hydro is presence of the water in the ureters. Hydronephrosis is enlargement of the kidneys due to presence of fluid or water. In the endometriosis, we have adenomyosis. Then we have endometrial carcinoma. So, thank you for watching sqadia.com.